उसी में से एक है पब्लिक हेल्थ डिपार्टमेंट के NABH स्टेट क्वालिटी ऑफिसर डॉक्टर जे मीना। मैं जे मीना साहब को निवेदन करती हूँ आप यहाँ पर आए और अपनी प्रेजेंटेशन प्रस्तुत करें। डॉक्टर जे मीना।
Respected all, good afternoon to all. For the quality improvement program, one is the important thing is quality is very sweet for the speak, but difficult to implement because quality is never improved without accepting fact. If we see our fact before, the building maintenance was extremely unsatisfactory, a leaking roof, indoors floor, overflow toilets, broken door, no patient satisfaction, no safe drinking water facility, no employee safety, poor lighting and no ventilation system. Poor sanitation and cleanliness, a very poor drainage facility, poor housekeeping services, a very poor biomedical waste facility and infection control practice, and there will be no cattle guards. The non-sterile suction tube and oxygen mask, empty oxygen cylinders, instrument with rust and non-steriles. Then how to achieve excellence in health? The answer is only one, total quality management system. The Gujarat take the initiative and our mission is to provide affordable, accessible and quality comprehensive healthcare, preventive, promotive, curative and rehabilitation on the national and international levels and to spread awareness about the health through health educations. Our vision to develop a primary health center which is facilitated with the modern technique and in which patients are being treated with the equity and without any discrimination of the caste, creed, religious and nationality. हमारे विजन एंड मिशन समाज ने राष्ट्रीय और अंतर्राष्ट्रीय स्तर में सेवाएं गुणवत्ता और सेवाएं मिले क्वालिटी पॉलिसी द हेल्थ सेक्टर इज कमिटेड टू प्रोवाइड क्वालिटी हेल्थ केयर सर्विसेज टू प्रोवाइड द ट्रीटमेंट एज पर द नेशनल एंड इंटरनेशनल स्टैंडर्ड टू प्रोवाइड ट्रीटमेंट विद द लेटेस्ट टेक्नोलॉजी to conduct training and workshop on the regular interval for the skill development of the staff, to improve the quality on continuous basis, to improve the quality of treatment as per the patient satisfaction and employee satisfaction. Our quality objectives to achieve standard as per the Indian Public Health Standards and NABH standards, to provide 24/7 quality services to the community, to implement and monitor all the national programs running in the districts, to provide right treatment through the latest technology, to ensure safety of the employees and the patients, to manage human resource for enhancing productivity. Our journey toward the quality, orientation to the quality and NABH standard to all the staffs, which is key. Formation of the committee because quality is never achieved by the single person; it's a teamwork. Internal assessment by the quality assurance teams, gap analysis and submission of the reports and planning for fulfilling of these gaps. Develop the action programs for fulfilling these gaps and propose to the TSP, NREGA, 112 and other financial resources like the NRHM and Government of India. Regular training of the board teams to standardize the objective elements, formation of the quality manuals, policies, procedure, format and standard operating procedures. The fulfilled all the gaps like the instrument equipments, infrastructure related gaps, human resource management, statutory requirements, and particularly the tribal area infrastructure related gaps is fulfilled by the TSP grants. The AMC, CMC, annual maintenance, calibrations, insurance of the instruments for the quality checks. Internal quality control and external quality controls also check the quality. The regular internal audits, plan to check in for the quality improvements, application for the pre-assessment done by the third party from the Quality Council of India, then gap analysis fulfilled and application for the final assessments and final assessment steps is fulfilled and then after the NABH boards give the certification for the accreditation. Our outcomes, if we see before 5 years, there will be no standards because lack of the standard we cannot improve the quality. The no gap analysis reports in the standard formats, lack of the statutory requirements like the license, AERB certificate, biomedical waste management rules and regs, absence of the written policy and procedures, poor sanitation and cleanliness, infection control practices, staff shortage is very big issue, poor specialists, lack of the training healthcare staffs, no concept of the internal audit like the medical audit, clinical audit and death audit. Inadequate infrastructure handling biomedical waste practices, no blood storage facilities, CSST central storage facilities, high donations, gynae, pediatricians and others, damage and poor condition of the building and staff, no calibration system of the instrument for the quality checks, shortage of the equipment and proper ambulance facility because previously ambulance is only a transport vehicle, it's not an ambulance. A shortage of the equipment, lack of the accountability and planning, absence of the quality standards, and low participation in the external quality and internal quality. The poor sanitation systems, absence of the patient and employee satisfaction survey, no measurable parameter for the patient safety, no realization of the problem and weakness, no motivations for reporting adverse events like the radialistic injury, sentinel events and others. Practicing non-accepting security arrangements, no implementation of the difficult code which is very essential during the disaster, like the red for the fire, yellow for the extra calamities, blue for the cardiac arrest, pink for the child abduction and black for the bomb threat. No teamwork is also lack of the teamwork, evaluation monitoring system is poor, poor publicity awareness services in the place, particularly in the community. Monitoring system is also poor, no responsibility for the referred patient, no display of the right and responsibility of the patient as well as the employees. If we see the outcomes, India's first and second NABH accredited TSP from the tribal area. Our success history out of 103, 45 facility from the tribal area and total 28 is accredited. Out of 28, 13 facilities from the tribal area. The benefits for the patients, the ability to the health services with the high quality of the care, or dedicated and essential medical staff, access to quality focused organization, right respect and protected, patient satisfaction, employment of the care process, patient safety, pain management, safe transport and continuity of the care. Ability of the service in PSC at the tribal area like the OPD, certificate of age fitness, lab services, homeopathic services, indoor services, delivery services, emergency services, vehicle for the referral, medical legal services, Mamta clinic like the all immunizations, medical checkups, family planning services, adolescent services, and NHP, abdominal tubectomy, MTP, hydrocele operations, and all the national program this is implemented. If we see all the laboratory services at the PSC level which is accredited like the hemoglobin, blood group, sickle cells, HIV, leptospirosis, pregnancy test, blood malaria parasites, AFB, urine sugars, routine urine, blood banks, TLC, DLC, syphilis, typhoid, water quality, and HIV electronic. A list of the service outsourced. Proper networking for the ambulance with the 108 for the referral services and prevent death, X-ray facility which is already outsourced, sonography facility, gynec and pediatrician facility also. If we see some photographs for the high quality care services, provide baby to newborn for prevent the infection and hypothermia, so they decline the IMR. High quality of the cares in one of the PSCs. High quality of the care in one of the CSCs. High quality of the care. Quality laboratory services in one of the CSC accredited. Management of the medications. Safety of the patient and employee. ABC before the vehicle is there, before and after the biomedical waste facilities, before and after the safe drinking water facility, and safe drinking water in tribal area is provided by the TSP grant. Food quality services, which is free to patient as well as attendant. Benefit to the staff, professional staff developments, provide education laid down standards, provide leadership for the quality, increase satisfaction and continuous learning, good working environment and leadership. If we see all the trainings which is given to the employees as per the requirements or skill developments like the managerial, administrative, or induction trainings for the staff, job-based skill trainings, special clinical skill trainings, minor surgery procedures, obstetric care, newborn care, basic life support care, and disaster also. We are also provides the awards to the employees which are doing good work. It is also provided in the national conference which are doing good work. This is the award NABH accredited to the PSCs. They are also award to the employees. Benefit to the hospitals, improve care, bring in corporate governance, stimulate continuous improvements, demonstrated commitment to quality care, rise community confidence, and opportunity to benchmark with the best. ABC1 or PSC in the tribal area, main entrance should be easily identified, welcoming, well lit, and with metrics. Because if we see the quality in health sector, the standard environment, standard treatment, and satisfaction for all. But this is also welcoming infrastructures, urban CSC which is accredited, CSC which is accredited, or district hospital Godhra in tribal area which is also going for the accreditation. And the 50 Healthcare Excellence Award. If you are doing quality work, then result is achieved. The India's first NABH Gardhoria PSC which is get 50 Healthcare Excellence Award in New Delhi. A benefit to the communities, the quality revolutions, disaster preparedness, epidemics, physical access to the complete database. If we see all the services which is provided by the healthcare facility like the PSC, CSC and district hospital, it display at the bridge and the distance is also on the road. Mock drills and training for the disaster management to prevent disaster. Mock drill and training for the disaster management during the fire safety. Mock drill and training. Involvement of the national programs, awareness in the tribal area. Involvement of the national programs for the awareness of the tribal area like the disabilities and other things. Malnutrition awareness, AIDS awareness programs, or PRI monitoring and evaluation of the CSC. Because we are not doing internal assessment, we are also doing from the PRI monitorings, so that our weakness is coming. A benefit to the governments. The efficiency of the government hospital is a key contribution for the building trust and confidence for the hospital in the heart of the citizens of the state. Through actively pursuing quality improvement program in various facilities, giving a sense of the pride of government of the ensuring quality service to the poorest of the poor, confidence has been restored of the community of the government hospitals. If we see the award received by the government of Gujarat for the quality improvement program in different levels. And yet, I cannot see by the papers like Aware India, Jagrut Bharat, rural health services in Gujarat to get the accreditation. The resource allocation toward the management for the TSP give the grants mainly for the infrastructure and instrument equipment. The number of the construction of the main gates, compound wall, cattle traps, shade of the waiting area, emergency room, maternity, labor room, X-ray, internal road, gardening, landscaping, renovations, dental chair, ambulance, instrument equipment provided by the TSP grants. The strategy is adopted for the sustainability. For the skill development like the appointment of the district level and district level quality assurance officers, we are also appoint the administrator, hospital administrators, directors. We are also giving the post-graduation certificate course to the all over administrators, doctors, give the new post to the clinicians, paramedical and other extra budgets from the NABH, NRHMs, 13 financial TSPs. Formation of the state level. Yes, that's for 1 minute. A challenge and solution like the infrastructure, manpower, vacant post fund, behavior, monitoring and evaluation. We are also taking the solutions. The road aim to create a quality culture based on the various standards which is sustainable, affordable, equitable and reliable, having state-of-the-art technology which can easily follow and replicate. The fourth part, lovely and dark deep, we have promised to keep and miles to go before we sleep and miles to go before we sleep. Thank you very much.
धन्यवाद डॉक्टर जी मीना, काफी कम वक्त लेते हुए बहुत